pick them up off, you know, tree, yeah.
My, where did you live? I was 600.
A lot of pretty trees, a lot of pretty trees. Oh, okay, yeah.
Oh, do you?
Yeah.
I have an appointment today to look at the supermarket.
So many pretty trees in Sugar Land. So many pretty trees in Sugar Land. You been to Sugar Land?
I just drove through the other day. I can't remember where else.
You should go down the Sweetwater Country Club Street and see the,
It was so pretty.
oh, really ridiculous. Yeah, they should be.
Hey, sweetie. Thank you so much for texting me this morning. Probably are here, and I just wanted to be sure.
To remind her of that.
Yes. How are you? Yeah, it's a
Who feel cold.
Yes, always feel cold, yeah. And I still feel cold, even when I had it here, it's just so cold. It is cold. You can't warm up. I don't. I'm still always cold. Really? But my hair does bad. Yeah, it is.
What's the longest amount of time you do this at home? Do you ever watch it?
You're from this area?
No,
Really? I could not believe it.
I'm at the end, so that's what I'm doing. I just finished, waiting for it, I got evaluated tomorrow.
You got to hear me between.
It looked great.
Work hard to do. I know it is for me. Like Dr.
Yeah. So I
So I was trying to learn on
Y'all have cleaned the deep?
Oh, me?
No way.
I said,
You know she's my special.
I said, I know
What
more.
time?
I said, I know more.
Oh my God, I love her. Oh, wow. she saw on Facebook.
No, we didn't feel it.
Sweet. Mia is a huge pastor. She was like a keynote speaker at one of the conventions. Oh my God, like 20,000 members.
Yeah, is this a new mega church? She was one of our stories.
Oh, absolutely. Let me look at it. Is it Church Without Walls? I know. She went to college with us. She was just in South Africa. I know, get a message from you. You didn't hear that?
Look over here, fighting by the
Good square around.
Well, I
was lost. Well, she was like 10 minutes away. Oh, okay.
I don't know. I think it's in, I don't know, it's in the suburbs.
Oh, so she's just really with
well, I told you what it was.
It's awesome. I just love that you're prayer. I have to come to her church sometime. Since I visited it.
I know that's right.
She's like, well, you can come on at the end, but you can't come on my church. I bet let's see. I have this lady come always
Good afternoon and welcome. My name is Diane Billings and I am a volunteer here at MD Anderson. I work in the hospitality room and in fact I recognize some of you who've come in there. That's a place for you to come and rest and relax and get to know each other and have someone to talk to, and we serve cookies and coffee and tea too, so wanted just to welcome you. This is the Mays Clinic, and we also have want to welcome the participants from Katy and Sugar Land and League City and the Woodlands. So thank you for seeing this, and we also are videotaping it. So for those of you who want to review it, you can see it on my Cancer Connection too later. So it is being recorded right now. We'll have, this is being sponsored. You can't hear it? Oh. Okay, we'll try it like this. This is one of 6 different sessions being put on wellness here at MD Anderson. And it's been sponsored by the volunteer services and the gift shop proceeds. At the end of the session, we will have time for questions. So even those of you remotely, if you have questions, you've got some cards in front of you. You can write your questions down, and we will take those questions and for Dr. Lopez. I want to introduce our MD Anderson expert. Dr. Gabriel Lopez is Assistant Professor and Medical Director of the Integrative Medicine Center at the MD Anderson Cancer Center in the Palliative Rehabilitation and Integrative Medicine. His primary clinical focus is providing integrative oncology consultations in the Integrative Medicine Center. Dr. Lopez is fluent in Spanish and has clinical and research interests in the areas of integrative oncology, supportive care, and patient-reported outcomes. He is on the National Cancer Institute PDQ Integrative, Alternative and Complementary Therapies editorial board. That's a lot to say. He is responsible for producing and maintaining evidence-based summaries on the integrative medicine topics for health professionals, patients, and the general public. He is currently a Society for Integrative Oncology board member and also a member of the Conference Planning Committee for 2018 Society for Integrative Oncology Annual International Conference. Please join me in giving a warm welcome to Dr. Lopez.
All right, so welcome. Good afternoon. I recognize quite a few of you out there, so welcome to those who have and perhaps haven't heard me talk about integrative medicine. I look forward to talking about something that is very important, and that is health. And one important aspect of our health is our immune health. And so I really want to give a broad perspective on how is it that we can support a healthy immune system. If you go out on the internet, if you ask any individual in the community, you can get a lot of different responses as far as what does it mean to have and support a healthy immune system. And some of that information that you will hear is, good, and some not so good. And so I'd like you all to get a better idea and create a perspective through which you can focus more on what are the real areas where you can work hard to support a healthy immune system and big picture also support your overall health. Can everyone hear me at the Houston area locations? Can I get a thumbs up or a wave? Yes? Okay, good. Just wanted to make sure. All right. And enjoy lunch. Please don't stop eating if I'm talking. Don't. So I wanted to share this visual image with you. I'll introduce a little bit more about who I am as well. So I'm a medical oncologist that does integrative oncology consultations at our Integrative Medicine Center. And so I'm going to talk a little bit more about what exactly is integrative oncology, what is integrative medicine, and how that all ties into health. I'll share that when patients do come to our center, one of the things that we work on as a team is on this integrative medicine care plan. And that care plan in that image shows a circle of diet, exercise, mood, stress, sleep, and symptoms. And I share this with you because the idea is to represent all of these aspects of health as being interconnected. And a lot of times someone might have a question about, well, how can I eat healthier? Or, what, I'm not sleeping well. And sometimes it's not just about sleep or health. Yes, sorry? Yes?
We're just trying to confirm on the slides so that you make email.
Oh.
Who can? If it's on there and email us.
Okay, so we don't have to
Take pictures or anything? Yeah.
That's what we were going to do.
I'll be happy to share,
Okay, thank
And so the idea is that any one of these aspects of health are interconnected with the other. And in order to be successful in following a healthy diet, for example, it's important to also be exercising, managing stress, and sleeping well. And so when I think about the immune system, when I talk to patients and family members about how to support a healthy immune system, it's not just about the immune system, it's about overall health. And if you're working on these different areas of health, so focusing on eating a healthy diet, getting regular exercise, managing stress, also making sure that you're getting good quality sleep, and also managing any symptoms, for example, pain, all of these different aspects of health, if they're not well managed, well taken care of, can have negative effects on immune health. And so really, in order to support a robust and healthy immune system, it's important to talk about how can you stay healthy overall. So I'm going to go through some definitions. And so here I'm just showing an image of what you'll find on the internet or in different published books, magazines. And again, there are lots of different references out there that you can look to for information. I'm not showing these images as recommendations. I want to be clear about that. I'm just showing this as an example of what you'll encounter on the internet if you search for integrative medicine, health, immune function, herbs, supplements. And so there's going to be a wide variety of data. Again, some good, some not so good. I'll share example for that magazine, that Time magazine article. It says alternative medicine. I'm going to share with you why the title for that magazine cover should probably have been better integrative rather than alternative medicine, speaking to the fact that with integrative medicine we're looking to use conventional and non-conventional health approaches together. We're not trying to find an alternative to health, and that's in part one of the challenges that you'll find on the internet, that people will talk to you about doing this instead of that. When it's really combining conventional and non-conventional approaches in a way that's safe, that's going to be most successful in supporting areas of health such as the immune system. So I'm going to read a definition. In the introduction, it was mentioned that I am a member of the Society for Integrative Oncology. And this is an organization, it's an international organization that's looking to create a standard for how integrative medicine can be safely and effectively delivered as part of cancer care. And so we recently, as an organization, published a definition, and I do want to read that because I think it's an important way of understanding how integrative medicine supports health. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So again, the goal of integrative medicine is not just any one thing, but it's about lifestyle, it's about health, and it can be complicated to really make good, well-informed decisions about what isn't important to do to lead a healthy lifestyle because of all the information out there and people having so many different opinions. And so I'd like to make the distinction between opinion and what's referred to as an evidence-informed approach, which means using the best available research evidence to make recommendations as far as what are things that are truly meaningful to support health. I'll share with you as well that some of the challenges are in how information is presented. And so just recently, earlier this year, there were recommendations from the American Society for Clinical Oncology, specifically in the realm of breast cancer care, on what kinds of integrative interventions have the highest level of evidence to support their use as part of cancer care. And I give this as an example because as time moves forward, we'll hopefully have more and more evidence, not just for breast cancer, but for also different cancer types, on where is the greatest amount of evidence, whether it's interventions like yoga and meditation or different supplements, and understand better what meaningful effects can these have on health, what's safe to do, what's not safe to do. As part of these more recent recommendations, I'll share with you So grade A, B, meaning having the highest level of evidence supporting their use. Music, meditation, stress management, and yoga were recommended for anxiety and stress. Meditation, relaxation, massage, and music therapy for depression and mood disorders. Meditation and yoga for quality of life. And acupuncture, acupressure to help with chemotherapy-induced nausea and vomiting. Now I share this because in that diagram that I had shown you all earlier about the integrative care plan, I mentioned that all these different aspects of health are interrelated. And so, for example, here we have evidence suggesting the benefits of music therapy, meditation, stress management, massage, and yoga to help with different kinds of mood disorders like anxiety, stress, and depression. We know that anxiety, we know that stress can have negative effects on the immune system. And so these can be different strategies, for example, that can be considered in support of a healthy immune system, but also in support of overall health. So thinking about ways to manage stress, and these can include music, meditation, mind-body movement approaches like yoga, tai chi, qigong. I'll share with you another definition. So there is another organization called the Academic Consortium for Integrative Medicine and Health, and this organization has members from the United States, Canada, and Mexico. And the goal of this organization is to create a standard of quality, a standard of care across all institutions that are members of this consortium, so that when a patient goes to an integrative medicine program, they know that they're getting the same level of quality care as that they're getting at another integrative medicine program. And so I'll read the definition here for integrative medicine. Integrative medicine and health reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. Again, it takes a team, it takes multiple aspects of health being addressed to really get at that goal of supporting overall health. So I'll share with you some results from national surveys regarding integrative medicine use. And so when you look at this national survey, this survey was done back in 2012. It shows that natural products were the most commonly used integrative therapy across individuals in the United States, followed by other practices such as deep breathing, yoga, tai chi, qigong, chiropractic, meditation, massage. Some of these areas which you've already heard about can be helpful for reducing anxiety, stress, and helping with mood. The challenge is knowing when these are more appropriately used and when it's safe to use these, especially in conditions that might make it unsafe. So for example, after surgery, immediately after surgery, it might not be the best time to engage in a movement approach like yoga, but it still might be helpful to engage in a meditation type approach, which doesn't have the risk for injury. This is showing the results of this survey as it follows over years. The arrows are specifically pointing at yoga use. Looking at the United States population, went from 5.1% in 2002, 2012 it was 9.5%, and these are the most recent statistics that were just released last month, and it shows that yoga use is now up to 14.3%, so up almost another additional 5% since 2012. And meditation use in the United States has gone from 4.1% in 2012 and jumped to 14.2% in 2017. So again, I share these because these are different approaches in support of health that are becoming increasingly more popular, more accessible, and so it's more important to learn and understand about what these really can do in support of health goals. This is a comprehensive list. Please write them down. No, just kidding. So you'll have. So this talks about all of the different areas of what are considered integrative medicine, complementary health approaches, according to the National Center for Complementary and Integrative Health. So this doesn't mean that there's an equal amount of evidence supporting the benefits or the health effects of all of these practices. It simply states that these are all the different aspects of health that can be part of integrative medicine that we in some cases know a lot about, and in other cases know less about. And so the challenge is in finding out how these different interventions, how these different therapies, whether it's nutrition, meditation, relaxation practices, how can these help support the goal of health and healing? So I'm going to come back to definitions. I mentioned earlier that there was a magazine article that talked about alternative medicine and how that might not be the best title for that magazine article. Again, alternative medicine, when that term is used, means using something in place of conventional medicine. So that would mean, for example, someone deciding that they're going to do acupuncture instead of chemotherapy or instead of surgery when that's the recommendation that they've received as a treatment for their cancer. That could be harmful, especially if it leads to a delay in treatment of a cancer that could be cured. Complementary medicine is used together with conventional medicine, so that's, for example, saying, well, I'll do this, why not? Might help, can't hurt. And integrative medicine is using conventional medicine in a deliberate manner that's personalized, evidence-based, and safe. And integrative oncology is applying integrative medicine to cancer care. So I prefer alternative medicine. Why? There have been quite a few surveys done as far as exploring why are individuals interested in integrative medicine, complementary medicine, alternative medicine. And so interestingly, one of the main reasons people seek integrative medicine approaches is to boost the immune system. Quite often I have patients ask me, is the first thing and the first reason why they're coming to integrative medicine is that they want to learn how to boost their immune system, in addition to other areas of health that individuals are looking for, such as improving quality of life, relieving symptoms, preventing disease in the first place, helping conventional medical treatment work better, as well as simply having had a recommendation from a family or a friend to pursue a particular intervention without any personal interest of their own. And so the challenge here is that if you go to a grocery store, pharmacy, health food store, you'll find a whole section, for example, on supplements that all say these supplements will boost your immune system. This will boost immune health. This will support immune health. The challenge is that from the evidence that we have to date, there really isn't any supplement that's going to be able to support immune health. And the supplement companies are very clear in how they define immune effects, because they can't say that the supplement actually has a direct effect on the immune system. They can use more of these kinds of terms that state they support a healthy immune system. But supporting a healthy immune system is really kind of an unclear statement, and in some cases, as I'll show you, supplements that can be sold to help support the immune system might actually be causing immune suppression or actually having negative effects on the immune system. The term boosting the immune system is something that we need to be careful of as well, because our immune system is normally in balance. And when the immune system goes out of balance is when our immune system either doesn't function very well or it's hyperfunctioning. So there are, for example, quite a few different autoimmune disorders, rheumatoid arthritis, lupus, that are examples of the immune system that's not functioning well. It's functioning out of check. And if the immune system isn't checked, if it's simply boosted, that can also be harmful. And so again, the goal really in supporting a healthy immune system should be in finding balance and supporting the immune system, neither suppressing it or arbitrarily enhancing or boosting it. So I'll introduce you to a little bit more to what the integrative oncology consultation is. So for example, if someone comes to talk to me and wants to know about integrative medicine, health, boosting, supporting the immune system, a lot of what I would do and the other physicians in our center would do is to provide as much information as we have available regarding the different kinds of interventions out there that would fall under the area of integrative medicine. I mentioned earlier about supplement bottles, and there are labels on each one of the supplements that you might find out there that say these statements have not been evaluated by the Food and Drug Administration. The product is not intended to diagnose, treat, cure, or prevent any disease, but the companies can still add statements to the product such as supporting a healthy immune system, even if there isn't evidence supporting actually that effect. So they can make statements without having the evidence. I'll give examples of some of the supplements out there that are quite popular but may have negative health effects. One is the Vitatox, which is a blue scorpion venom, and this has been sold as a cancer cure, especially in liver cancer. Unfortunately, it seems that it actually may promote cancer growth. Another product is Essiac fluorescents. These are sold as either extracts or teas. And these have also been shown in what we refer to as preclinical, pre-human studies to actually increase breast cancer growth. And so there are challenges as far as what supplements are sold for and what they actually do. And that's a challenge. Green tea extracts, for example, have been sold to help support health. The challenge of the extracts, especially when they're in high doses in pills, is that they can actually have negative effects on liver function and may lead to liver damage. This is an example of a study that was done using maitake mushroom extracts. If you go to a health food store, pharmacy, one of the most common products that you'll see as far as herbs and supplements sold to support the immune system are mushroom products. There are all kinds of different mushroom extracts, from single mushroom extracts to some blends that have 17 or more mushroom extracts in one pill. The challenge is, it shows in this study, and I have this blue line with an arrow that goes up and an arrow that goes down. The number across the bottom, right here. So the number across the bottom where it says 0, 2, 4, 6, 8, 10, that's the dose of the mushroom extract. And as it shows here, it's showing different aspects of immune function. And in this example, the higher the dose of the mushroom extract, the more the immune system is actually being lowered. So the arrow going down means that the immune system is being suppressed, and the arrow going up means that the immune system is actually going up from baseline. So this is what I would really consider an unpredictable immunomodulatory effect of a mushroom extract. And this is looking at a single extract as part of a really well done clinical study. The challenge when you start to put multiple mushroom extracts all together is that it really becomes unpredictable what the immune effects can be. And some of the concerns are that with a lot of different cancer treatments right now, including immunotherapies, that there are really significant, but potentially significant interactions with these immune therapies that can lead to either increased toxicities or potentially decreased effectiveness of these treatments, which would definitely be something of concern and potentially harmful. I'll give some other examples of things to be careful about with supplements. This is a list, by no means comprehensive, but there also have been quite a few supplements that have been brought to attention as far as their concerns, as far as connections with increasing bleeding risk. And so, for example, on this list I have garlic. That doesn't mean don't eat garlic. That means garlic extract. So different. One's a food, one's not a food. This talks about echinacea products, not related to immune health, but specifically about supplement quality. And in this study, what they actually found was that in 10% of formulations that were actually being sold over the counter, there was actually no detectable echinacea. So this is another concern, that if you're going to buy supplements, there's a risk that there's actually none of the supplement that you're buying in that bottle. And that's of concern as well. This is another study that was done using DNA barcoding technology, and this shows that in less than 50% of cases, that's shown by the blue bar, in less than 50% of cases you actually had the authentic product in the supplement that was being sold over the counter. Then you had that followed by close to 60% of products having incorrect product labels, and in about 30% of cases you had substitutions. And in about 10% of cases, you had no detectable sequence of the supplement that was being sold on that bottle. So that's a whole separate issue of not only is there a risk that the supplement might be harmful, but there's also the risk and concern that it might actually not even be there. And the question of if what you think is there is not there, then what is there? One of the examples that they gave in this study was that in one particular product that was being sold as St. John's wort. St. John's wort is commonly sold over the counter as a supplement to help with depression and mood symptoms. And in this study, they found that in one product that was labeled as St. John's wort, it was actually Colace instead, in place of St. John's wort. Are you all familiar with Colace? Yes. Right? It's a stool softener, right? So there was a stool softener in place of an antidepressant. So these kinds of things can be truly of concern and can potentially be harmful if you have someone that's already having significant diarrhea, for example, associated with either their cancer or the cancer treatment. To unknowingly be taking a supplement that's going to further stimulate bowel function can potentially be quite harmful.
Excuse me.
Yes?
Who did the study, the 44 herbal?
This was the author states there is a Newmaster. It's from BMC Medicine is the journal. That was published now back in 2013. And this is an example of one patient who came to our center looking to take supplements to help with not only helping to treat the cancer, but also helping to support the immune system. And what I wanted to bring your attention is that this is a list that states mornings. So this is the list of the supplements that this gentleman was taking in the morning. And there are similar lists for the afternoon and evening. And the concern is, and I've kind of just marked it on there, one of the supplements is called Host Defense 17 Premier Mushroom, 10 drops. Another one is Beta Glucan, 2 caplets. Another one is called Host Defense 17 Premier Mushroom, 3 caps. These are 3 different mushroom products, all of which can potentially have effects on the immune system. You put a lot of these together. He was taking similar doses later in the afternoon and the evening. So taking really high doses of these things really, I would say, really has an unpredictable effect on not just immune health, but there are also concerns about any other supplements that someone might be taking that are necessary. So if someone needs magnesium and potassium, for example, because they're having depletion of those nutrients because of, for example, the chemotherapy that they're getting, taking so many other supplements might interfere with one's ability to even absorb the supplements and nutrients that one needs to have in the system. And not to mention any medication, pills, whose absorption might be affected by taking all these different supplements. So when I talk again about health and really supporting health and immune health, really focusing on diet, exercise, supporting a healthy weight. Regular exercise helps to support a healthy immune system. And then we've learned so much more about the negative effects of other specific foods. I'm not sure how many of you all have heard about carcinogens and processed meats. Has anyone heard about that? Okay. Yes. So as it says here, red meat probably carcinogenic, processed meat definitely carcinogenic. And so processed meats are within the same carcinogen category as asbestos, tobacco smoke, and alcohol.
You said alcohol?
Yes.
Like, what about like wine? I've heard processed, well,
I'll comment. And so there's really no health benefit to alcohol consumption, and alcohol can come in different forms, wine being one form through which alcohol can be consumed. But whether it's beer, wine, or liquor, the alcohol is just as harmful to one's health, and it is considered a carcinogen. So, and right now,
the definition of a carcinogen.
Something that actually creates damage to the DNA in our body. And for example, most recent recommendations by the American Institute for Cancer Research are that, especially in women who have a breast cancer history, no alcohol is the recommendation right now because of associations between alcohol intake and cancer risk. And so the more we learn about some of these things, the more we learn that if you just kind of hear people saying, oh, drink wine, it's really good for you, well, it might not be. So it's important to understand really what the evidence shows and what we've actually learned from research. And I'm sharing here as well, so as far as risks beyond tobacco smoking, obesity also has quite negative effects on health risk and has been already associated with a number of cancers that I have listed there, including esophageal, liver cancer, kidney cancer. I just give this example of, I saw this brand that was being advertised as 100% organic tobacco. So there are things that can be offered and sold as healthy, which aren't healthy. I could have put here organic gummy bears, for example, but there are things that can, depending on labeling, can be sold and advertised and made to look attractive, but in truth, they really are just as unhealthy for you as other unhealthy products within that same category.
100% natural lawn.
Correct, yes. Right, but it's natural, right? I mean, but it doesn't mean that it's really healthy for you. So, and so nutrition and exercise, and I speak to these because nutrition and exercise go hand in hand to support health. And as far as looking at supporting a healthy immune system, exercise is really not just critical in helping to maintain a healthy weight, but exercise also helps to maintain a healthy mood. It helps to support healthy sleep quality, all of which are important factors in supporting a healthy immune system. I'll talk about some of the specific services and just go briefly through what these different interventions in integrative medicine can do. And I show you this as an example of what an evidence-informed framework is. There are some people that you might hear say, oh, acupuncture can help boost my immune system, or acupuncture can help my blood counts during chemotherapy. You can hear a lot about that, but really the evidence is very limited and not so good to support that effect of acupuncture. What we do know about acupuncture is that it can help with symptoms like pain, nausea, dry mouth, hot flashes, fatigue, and neuropathy. Massage can help with anxiety, stress, pain, constipation, neuropathy. And again, these therapies, although they don't have direct effects on the immune system, if you're doing things like massage, for example, that can relieve anxiety and stress can have negative effects on sleep quality. Stress can have negative effects on the immune system, and so if you're decreasing anxiety and stress with something like massage, that can have beneficial secondary effects on immune health. Mind body practices, again, can help with anxiety, stress, improving sleep quality, all of which are also health supporting interventions. I'll show you this on our Integrative Medicine Center website here at MD Anderson. We do have videos. We actually do have group classes that offer more information about interventions like meditation, yoga, tai chi, qigong, and really the goal of these therapies is to help with increasing physical activity, increasing mindfulness, helping with reducing stress and anxiety, helping to promote healthy sleep, all of which are things, again, that are going to help support a healthy immune system as part of a healthy lifestyle. Music therapy I'll speak to as well, helpful for relieving anxiety and stress. And I'm going to come back to the integrative care plan. I did want to share with you a definition, and so I'll share with you that when I came to medicine practice, I came to medicine with a background and interest in anthropology and archaeology, and I want to share with you a definition that comes from what's referred to as medical anthropology, which is a medical perspective on anthropology, and this idea of disease versus illness. And I'll read these to you. So disease are abnormalities of the structure and function of body organs and systems. Illness is a subjective response of the patient to being unwell. It's the experience of ill health and the meaning given to it. And in modern medicine, so when you usually go see your doctor, there's usually a focus on, in this case, we're discussing cancer. So there's a focus on treating the cancer, which is the disease, but not on the illness. And the concern that I would share that a lot of patients have, and that we have as well, is that if we focus too much on the disease and not on the illness, we might be losing on some potentially beneficial interventions that can help support that illness experience, so you don't feel ill as you're having your disease treated. But again, the illness is again how you experience having a disease. And that's where I think we can really have meaningful effects on health. It's learning about how can you live with that disease, experience that disease, and continue to support your health. And a lot of times this ill health there's a lot of a strong mental component to how you feel and how you think about having a disease, and that itself can have negative effects on your overall physical health too. So I come back to the integrative medicine care plan. So if we look at diet, exercise, mood, stress, sleep, and symptoms, these are all tied in to each other. And so, for example, if I were to have someone tell me that they're not sleeping well, and they're interested in supporting their immune system, I'll talk to them about, well, how can we work on sleeping better to help support a healthy immune system, but I'll also explore areas of stress. How are you handling stress? Are you having any anxiety? What are your worries? Are you getting regular exercise? Are you making healthy food choices? And so really an exploration of immune health is really an exploration of overall health. I don't have any one strategy that's going to fix the immune system, and so it does take a comprehensive approach and a team approach and what I would call a not disease-centered approach, but a person-centered approach to really find out how to support the immune system. Too often there are websites that you might just kind of read and it says, take this to support your immune health. It's not that easy. It does take discipline on your part and really learning about what are some meaningful changes you can do to your overall health to get your immune system at its best. So thank you very much.
Thank you, Dr. Lopez. And if any of you have any questions, if you'll write them down on those cards, and we'll collect those. Just raise your hand when you have one ready, and we can do that. And
if there are any questions from the Houston area locations? Okay.
I have a question on links between chronic inflammation and diseases like cancer, and anything maybe lifestyle changes that might affect inflammatory state.
So I'll say that cancer is in many cases considered an illness that can be considered a chronic illness, and there are definitely benefits to helping to work with someone on looking at overall health and lifestyle independent of the cancer itself to help to decrease inflammation, to help to support health. And so a lot of times I would say there's too much of a focus on how health can defeat or destroy or eliminate the cancer, but it really should be more focused on how can you help support an individual's health to be in a better place, to be successful during cancer treatment, whether it's decreasing inflammation or engaging in other health supporting activities like maintaining a healthy weight, exercising, sleeping well. Is that helpful? Kind of? Okay.
Hi, Katie has 2 questions.
Oh,
The Katy location, we have 2 questions.
yes.
Okay, we have one question about if you can recommend or speak to a good type of vitamin, multivitamin to take.
And there was a second question?
Can you address the first one? Yes.
Okay. So as far as a multivitamin, from the perspective of needs to take a vitamin or a mineral supplement, really a multivitamin is only something that we'd recommend to someone that has an absolute need to take a multivitamin. There really isn't an indication where you can say, well, you might just kind of take that vitamin because it might help. Really, I would say the focus would be on not taking the multivitamin, but on taking the vitamins that are needed that might be in that vitamin that would be relevant to that individual. So for example, if someone needs calcium and vitamin D for their bone health, then take calcium and vitamin D. If someone needs vitamin B12, for example, they're following a vegetarian or a vegan diet and they need B12 supplementation, then take vitamin B12. But outside of these circumstances where you're taking vitamins because of a specific need, it would really take a careful discussion with the medical team to understand whether or not there really is a role or a need for a multivitamin.
Thank you. Okay, our second question I'm going to let the patient ask. Yes.
Yes, acupuncture and massage therapy as part of the integrative medicine program is not covered by insurance. So patients have to pay out of pocket initially a consult fee and acupuncture like twice a week for like 8 weeks and stuff. So does MD Anderson have a program to assist patients to be able to afford an acupuncture session or a massage session so they would benefit from for neuropathy or neuropathy induced from chemotherapy or other causes?
So great question about acupuncture and massage. And so there are some insurances that do cover the cost of acupuncture and massage. There are more insurances that don't cover than do cover, and that makes it a challenge. There are opportunities for financial assistance depending on the individual to help support patients that can benefit from interventions like acupuncture and massage. Outside of individual treatments, for example, through our center, there are also opportunities to look at research studies, and participating in research studies that offer a massage or acupuncture can also be another way of receiving these treatments at no cost. For example, we recently had a study that was looking at massage to help with relief of chemotherapy-induced peripheral neuropathy caused by oxaliplatin and paclitaxel chemotherapies. There was also recently a study looking at acupuncture to help with dry mouth symptoms in individuals receiving head and neck radiation. So looking for participation in those kinds of trials is another way to have an opportunity to learn about how these interventions can help with symptoms.
I actually had two questions. One had to do with like being too sleepy or lethargic and like sleeping a whole day. Could that in fact cause dizziness if one is experiencing dizziness on a day where they're just exhausted, getting up or something of that nature? That's the first question.
No, so I'll speak to the question about dizziness, tiredness, fatigue, and especially if that's happening throughout the day. What can that mean? I will share with you that can mean any number of things. I mean, that can be simply just being tired, exhausted, whether it's from having a long day, for example, going to multiple visits. A lot of times during cancer treatment, an individual's energy reserve goes down, and one really, really busy and active day, it might take a day or two to recover from that, and that can lead to significant fatigue and really a need to rest and recover on the subsequent days. But sometimes that kind of tiredness can also be a signal of other conditions going on. For example, fatigue and tiredness can happen from low thyroid function. It can happen from anemia, which is low hemoglobin. And the more tired days, the less active we are over time, the worse our physical conditioning gets too. And so sometimes being tired has to do with not getting that regular exercise, not sleeping well, and then just getting more deconditioned and more tired, and that just continues to build on itself. And so sometimes all these things come together to create a situation where you are tired, and you speak to dizziness. Dizziness can signal a number of conditions, but sometimes dizziness can be something caused by something as simple as dehydration or not having eaten enough. And so making sure that you're staying well hydrated, that you're, if you're not able to eat a large meal, that you're snacking frequently, and really, I would say it's always a challenge to find out what these symptoms are being caused by, but it's always important to share with the oncology care team when these symptoms are happening to make sure that the most, the potentially most harmful effects, the most dangerous things are kind of excluded, and then we can help focus on those things that can help you to feel better and recover. One more?
Thank you. And
yes.
The second question was about, you talked about green tea extracts.
Yes.
And by the same token, I was thinking about, I drink a lot of green tea, but no extract. And then also in the healthy cooking nutrition class, turmeric was suggested. And do you based on what you said about the over-the-counter pills, that gives cause for concern in that perhaps one might be taking the turmeric pill, and then also you mentioned something about green tea. So if you would elaborate a little bit more on that, I would appreciate it.
Yeah. And so the Cooking for Optimal Health class is a class that is taught at our center once a month by our dietitian, Carla Crawford. And to speak to the turmeric, for example, so turmeric is perfectly fine to use as a healthy spice. But what I would not recommend is taking turmeric as a supplement, as a pill, unless there's a clear reason to take it. And that would involve really a discussion with the oncology care team and other individuals involved in that individual's cancer care. But using turmeric as a spice, it's a healthy spice, and it can certainly be added to a number of foods for either color and flavor, and so there would be no problem with that. It's the packaged extract or concentrated pill, which is no longer a food. It's a supplement that can be of concern and has those concerns, for example, of increasing. And then the green tea, what I was going to comment on is that it's green tea extracts that have been shown to be harmful as far as causing toxicity and harm to the liver. But drinking green tea in moderation, as anything in moderation, has really no negative health effect beyond perhaps drinking green tea that's caffeinated in the evening and having that get in the way of sleep quality.
But not alcohol.
And alcohol does not help sleep, contrary to. Yes.
There's two questions here. After radiation and chemo, we're told to eat whatever to keep your weight up to avoid a feeding tube. How does integrative medicine deal with maintaining weight during recovery? And the other question is about white sugar, because they've heard that people reduces the size of their tumors, but the doctor says it doesn't.
Yeah. So one of the questions was what to do when there's a recommendation as far as doing whatever is necessary to maintain weight, and how does integrative medicine address that? And the second question was about white sugar and kind of how to approach white sugar as far as a food. So I'll comment that as far as maintaining weight, there are negative health effects to losing weight during treatment, and so although it would be ideal to say that it's always best to eat as healthy as possible to maintain the weight, losing the weight is also a challenge and something that's not so good for health. And so it's always about achieving a balance and working with a dietitian, for example, to make sure that that individual is getting the right amount of calories and protein that they need to support health and healing during treatment. And that might require not eating the healthiest foods for a short period of time and eating very high calorie foods, but then transitioning to healthier options as soon as that would make sense and is safe. And as far as white sugar, really from what I would refer to as an integrative approach, we do emphasize trying to avoid eating foods that have added sugars, and that's added sugars in the form of refined white sugar. But sugar that naturally occurs in foods, for example, whole grains, brown rice, quinoa, oatmeal, those naturally occurring sugars are complex sugars that are actually quite healthy. The kinds of sugars that we recommend avoiding are those where you kind of add sugar to food. That's less healthy, no nutritional benefit beyond calories, and can have negative effects on health, and in particular heart health and also blood sugar levels. Oh, League City? Yes.
Okay.
Hi, Dr. Lopez. I was visiting with a patient receiving chemo this morning, and he mentioned that he was taking RSO oil and seemed to have benefits from that. I was just curious what you would have to say about that, if you've heard about it at all.
So I'm not familiar with that abbreviation, RSO. Do you know what it said?
I'm sorry, I don't know any more than that. He called it RSO oil, and he said you can't get it easily. In fact, he said he had to get it in Las Vegas for whatever that means. But it seemed that he and others have taken it and have seen results in their opinion in terms of affecting their cancer.
So I'll share with you that there are lots of supplements out there, lots of different kinds of oils. Cannabis oil has been one that's been quite popular, and a lot of people ask about it. I was going to ask you. Yep, I was going to ask. It might be Rick Simpson oil, which is one of the cannabis oil products out. That probably is what it is. But it's right now, as far as the cannabis oil products, whether it's the Rick Simpson oil or other formulations, there really is not enough evidence to suggest that there is any anti-cancer or cancer treatment benefit. We do need to learn more about what the benefits are of these kinds of cannabis products as far as managing symptoms related to cancer or its treatment. And there's at least some evidence suggesting benefit as far as helping with pain, appetite, and nausea. Any more? Or should
Yeah,
you do cards?
yeah, I have some more on the cards
more
here.
cards.
These two kind of go together. How do you get a consult referral to integrative medicine, and how can we get more people involved in integrative medicine classes?
And so the question was about how to get a consultation to integrative medicine and how individuals can get more involved with integrative medicine classes. And so any individual that does want to have a integrative medicine consultation would need to get a referral from one of their oncology care providers. And they do have to be patients at MD Anderson to be able to be seen at the Integrative Medicine Center. And right now we only have facilities at the main campus location, and so there's no Integrative Medicine Center consultation at the Houston area locations. And then the second part was about the group classes. Yeah, and so so at the Mays Clinic, so just a little bit above us and off to the side, next to the Hospitality Center is where we have our Integrative Medicine Center group classes. And those are available to patients, family, caregivers, really anyone at MD Anderson or in the greater Houston community affected by cancer. And those include yoga, meditation, the Cooking for Optimal Health class that we talked about. And those, again, those are free and available at our center. At some point in time, I hope that we can have more of these classes available outside of the main campus and available at the Houston area locations, either in a live format or a similar feed like we're doing right now. Yes. Please, yes.
Okay, I'll have to keep it?
Yeah, I'll hold it if you talk.
Okay, thank you so much. I'm new patient. I'm 7 years old man. Following the question about the multivitamin. For 15 years, since I was 55 years old, because they said 50 plus, you needed this, I take 1 tablet a day till now. And also I had a knee problem at that time, glucosamine DS capsule from Walgreens, the same thing, for 15 years, without consulting with any doctor, by myself. I take it 1 a day, till now. Recently, they find out I have CLL, which is a chronic lymphomatic leukemia. Still, I didn't start treatment. And also bodily, I'm strong enough because I'm very active, almost 50 miles a week by daily. I biking. Wonderful. And also for 10 years, I'm swimming every other day, 1 kilometer for 30 minutes. So no any other medication. So you would suggest I stop that multivitamin and that capsule, which I never discussed with anybody till now with you.
Yeah, so I'll share with, thank you for sharing that, and it sounds like,
because the way I heard it looks like might have an effect for 20 years or 15 years, take that capsule because in the years of this might affect something.
So what I would recommend is that definitely to talk with the oncology care team, because if there are any deficiencies that might occur as a result of the treatment that you'll be receiving or are receiving, it would be important to know if any one of those vitamins and minerals in that supplement would be important for you to take. But otherwise, there are concerns about also potential interactions. A lot of times, high doses of antioxidants in these supplements can potentially have effects on interfering with treatment and protecting the cancer cells as much as they might also protect our healthy cells. And so it's an important conversation to have. I will share that now back in 2011, there was a study called the Iowa Women's Health Study. This was following women for a 20-year period, and they found that the women taking a multivitamin as part of that study had a higher risk of death over that 20-year period of time. They didn't connect it to heart disease or cancer, but there are definitely potential negative effects to taking supplements long-term that we really have more to learn about.
That's why I ask this question. Thank you.
How big an effect was it?
I'd have to go back to the specific study to find out what the effect size was on that. One more?
Elaine has a question. Yes.
And Sugar Lane, you have a question?
Yes, we do. Go ahead.
Hello, I was wondering if there is some sort of list or some place that we can find which supplements are harmful. Is there such a list or some place we can go to check on what we are taking?
And so great question about the safety regarding supplements and where you might be able to learn more about that. If you go to our Integrative Medicine Center website, which is through the MD Anderson website, we have links to different resources. There's one database called the Natural Medicines database that provides really a comprehensive review of different studies that have been done on integrative medicine, different supplements, and puts that in a summary of potential interactions, benefits, risks, and really weighing the evidence. There's also another website called About Herbs that's published through Memorial Sloan Kettering, the Cancer Center, and they also have an app available that's quite helpful. And the National Cancer Institute PDQ, which is Complementary Alternative and Integrative Medicine website, has both a patient and professional document format that you can read more about the latest evidence on different integrative therapies. So there's some good websites out there. It's just a matter of finding them, and you can definitely find them on our website, or otherwise I can definitely have a list sent out to everyone participating today.
That's all the time we have for questions. We thank you very much, Dr. Lopez,
thank you
for your presentation and answering the questions. And thanks to all of you for your questions. If you didn't get your questions answered, or if you think of a question coming up, you can email it to mycancerconnection@mdanderson.org. So it will be answered there. So please do that. And also we have evaluations. If you could fill those out before you leave, we'd appreciate that. And you can give them to Diana as you go out.
I'm gonna mention one other thing, that we are right now working with the Learning Center on creating a patient education class on integrative medicine. The Learning Center has really so many valuable resources that discuss mind-body approaches, videos that can be helpful for Tai Chi, Qigong, yoga. They can be also a wonderful reference for finding what resources are available either in print that are available at MD Anderson or online. So I'd suggest that you go to the Learning Center as well to find more information if you want to explore a topic further. Okay, thank you.